industry for healthcare and technology, willing to share some of their experiences and help us all get to that next level. So first and foremost, let's introduce our guest. We have Christine Ivory, MPH Chess. She's a project manager at the Jefferson Collaborative for Health Equity. She's also a founder and CEO of Public Health John, podcast host of Public Health Gems. And she's gonna give us some gems tonight, okay? Yes. Christine Ivory is dedicated to addressing inequities in healthcare, mitigating issues within the Black infant and maternal mortality crisis. Her passion is to help all walks of life through disease and disparity prevention, as well as to make an impact in the community she serves. And she does that. Christine serves as Regional Director of Sisters in Public Health and the Community Health Planning and Policy Development, Section Counselor for the American Public Health Association. She is a proud member of the Drexel University Center for Black Cultural Advisory Board. Oh, her achievements just go on and on. Christine, I don't know how you have the time to do all this, girl. I love it. And let's not forget, she presented her first TEDx talk, Igniting Change in the Black Maternal Mortality Crisis in 2022. That deserves a round of applause. Let's give it up. Christine holds a bachelor's degree in exercise science kinesiotherapy from Norfolk State University, a master's degree from Drexel University in Public Health and Health Education Specialist Certification, CHESS. Thank you, Christine, for being here. Audience. Next, we have Mary Manja, Program Manager at Google. And there is dynamic and results-driven professional with a strong background in product development and product management. Currently, she serves as a program manager at Google, where she leads Gen, AI, and ML initiatives within the commerce organization. Her recent projects have focused on integrating augmented reality experiences into the Google product page. And we love to see it on the Google page. Way to go. Okay, her expertise and passions revolve around leveraging AI and machine learning to drive innovation and create transformative solutions. Envy is also the co-owner of Timbe, a fitness brand that seamlessly marries her dedication to health and fitness with her appreciation for cultural enrichment. And she has dance moves. Y'all might see some of those tonight. And their diverse experience in both corporate endeavors and entrepreneurship have shaped her unique perspective, rendered her a valuable asset in various professional pursuits. Beyond her professional engagements, she owns providing guidance to startups and small businesses on growth strategies, partaking in weightlifting, okay, exploring tropical destinations, and picking new hot sauces to try. Okay, you spicy girl, love it. Thank you, Nthere, for being here. Last but not least, we have Olubode Akinle, is a passionate healthcare administrative and a technology professional in the DMV with over a decade's worth of experience in the industry. He currently serves as a senior business analyst for Accenture Health, a healthcare technology company focused on providing innovative solutions by leveraging technology. Love that you're here and love that you're bringing both spaces together. Thank you. Yes. Before Accenture, Bode worked at the DC Department of Healthcare Finance as a functional lead, driving business design efforts that resulted in the successful implementation of a $150 million medical assistance eligibility system release. Way to go! Though throughout his career, Bode has held various roles focused on managing healthcare services, advancing service delivery operations providers with a specific focus in long-term care. Originally Nigerian descent and currently resides in Prince George's County, Maryland, he holds a bachelor's degree from Morgan State University in health education with a concentration in health admin and a master's degree from the University of Maryland, GC, and health administration and informatics. Thank you for being here, Bode. All right, y'all, so we out here, we doing it. Let's get into it. Okay, so the panelists want to tell us a little bit more about themselves, and they also want to tell us what they love about being in their fields. But hey, we'll have you first.
So how's everyone doing today? My name is Olubode Akinle. But people call me Bode. I'm a senior business analyst for Central Health, which is a company that focuses on financial platforms for states for Medicaid claims reimbursement. One thing I like about my job is that I get to work with many professionals who have a deep skill set and knowledge base. And that helps me accelerate my learning curve in terms of the healthcare platform.
Thanks.
Hey y'all,
Hey.
I'm Sarah, a program manager at Google, and what I do love about the space that I'm in, so I work on 3D assets, and that's essentially like how can we take things that are 2D form and like use them to try on. So I'm very deep in the technical space and deep in the innovation space, and like seeing things that haven't been done before is really, really exciting. One of the use cases for like specifically the medical field is like how can you try on prescription glasses and like see what they look like, and like that's very futuristic, but it's also something that we get to like use and do over and over again. So love the innovation space.
Yeah.
Hi everybody, good evening.
Good evening.
Good
Y'all having
evening.
a good time at this event?
Yes.
Oh no, I need a little bit more energy in the room. I'm Christine Ivory. Lola's really great, eloquent introduction. I'm a project manager at Thomas Jefferson University Hospital at the Jefferson Collaborative for Health Equity. So what I love about the work that I do is it is all in circling around health equity, meeting people where they are, whether that's chronic disease, whether that's maternal health, which we'll get into tonight. It's really just having that on the ground focus of meeting people where they are. So that's what I mean.
So first question, what steps did you take to enter your field?
Sure. So I got kind of lucky coming out of college. So essentially, in my senior year, my university required us to have an internship program. And so, I was studying health education, but the curriculum was more so like public health, that concentration in health administration. So I was living in DC, I was going to all these different companies, public health companies, agencies, Blue Cross Blue Shield, you name it. Just trying to secure an internship, and I was having zero luck because that market is really competitive. And so I took a moment to step back, and I changed my approach. I said, instead of me going to these companies and asking for an internship, I said, you know what, I would love to volunteer, right? And so for them, it was like, there's no financial obligation, no application, none of that. So it was just literally forms. They said, okay, cool, allow you to volunteer. I utilized the opportunity to go ahead and get my knowledge up, get my skill set up, also network with the people I need to network with. And then I had a short window to kind of sell them and say, hey, I have to go find me an internship in order for me to go ahead and graduate. Either you all can sponsor me or I have to go outside. And then we were ready to develop the relationship. They trusted my work. I was even doing work with them, so they didn't want me to go. So then they ended up giving me a internship. I paid it. I know. And so after that, graduated. They let me go for a little bit, only because when I graduated, so I'm like an intern, but later on they brought me back on, and then continue to train me up, and then eventually that's where I'm at today.
So I think for me, my journey is definitely more heavy in the tech space, but because I have an affinity and a love for like the health and fitness space, I've always had to like make that known and make that like desire there. Like I worked in consulting prior to being at Google, and every project I was like, hey, I'm also interested in healthcare. How can I do this? So like sometimes like the piece that's really important is like letting everybody know. Like if I saw somebody that was like in a field, I would like say, hey, like let's chat, let's connect. And just having the sense that like it's out there somewhere for you was like my first step. And then education, of course, so, like I'm interested in the space, so what can I do to make sure that I'm like getting myself accredited, or like I understand exactly what I'm really focused on. So that was like the second piece. And then the third one is I did go to my MBA program to like network and expand, and making sure that I like found people in different areas. Do you work in like health tech, fitness? Do you work in predictive monitoring? So it was a lot of research, a lot of asking and saying it out loud, and like eventually the cards aligned, and so that's how I'm here today.
Yeah, I think breaking into the public health field is maybe a combination of what our two panelists mentioned. For me, with public health, it was finding out what public health was. I know a lot of us during the pandemic found out what public health was as we approached COVID-19. But prior to that, I was working at a community center in Philadelphia with one-on-one client care. So many patients and so many clients had questions about breast cancer and about hypertension. And I wanted to help from a public reach, to have a really big outreach to the community. And so finding out what public health was, I said, let me go to school and pursue that. So I received my MPH, and there I learned about the crisis of Black infant and maternal mortality and how Black women are dying at disproportionate rates compared to their white counterparts. And it was a no turning back moment for me. So from there, I had the opportunity to be a health educator. Then about a year later, list out on a project and really lead a project around project development around Black infant and maternal mortality. And about a year or so later, direct different projects within that realm. So I just say that to say, it was a zigzag trajectory for me, not linear at all. and still really is, and I enjoy that way looking in my career in public health. So a lot of different puzzle pieces.
Good. Oh, y'all can keep it, because we're just gonna roll through. So why do you guys believe technology is beneficial to the healthcare field? And y'all kind of tapped into that a little bit, but can you talk about it a little bit more?
Sure. So I'm going to speak from my experience again, which is government tech. And I work mainly for like the Medicaid health systems. Technology definitely is a catalyst to help us reduce errors and inefficiencies. You know, if you make errors in healthcare, it can be extremely costly. If you make errors in healthcare with someone's livelihood, you could potentially lose their life, right? So healthcare kind of helps us reduce the probability of those risks, you know? And again, also healthcare inefficiencies. So in my previous position, I worked as a program specialist for our long-term care population for the District of Columbia. And at the time, they had assessments, they had healthcare services called home health services, where you would have individuals come in, provide home services to the elderly and physically disabled. And what would happen was that they had case and care managers who would actually be the ones to recertify for their assessment and for their services. But what would happen is that they would do it at their own leisure time. And so they would miss the time period to reassess these individuals, and essentially these individuals would actually go without care. And then what would happen is that these individuals would be admitted to the hospital for things that were technically preventable. And so what happened was that they ended up saying, okay, we need to go ahead and fix this, and we're going to utilize technology to go ahead and do so. So what they did was they implemented a new electronic health record system that had the ability to go ahead and notify the case managers 90 days before those patients' assessments were due. They also notified the case managers' agencies as well. And then if the case manager continued to fail to reassess them, then they also kept a record of that, which ended up impacting their payments. So essentially they used technology to go ahead and course that in action for those case managers. And that's why technology is important to healthcare.
Yeah, that's good. That's good.
Yeah, a lot of the pieces that I work on, the general theme is always personalization and connectivity. So if there is, like, in the future of healthcare, you have, and there's a lot of privacy and regulation issues with this, but like connectivity around your data, where like your dietary, your vision, your like healthcare records are all kind of like connected in a way to give you a holistic picture, where you don't necessarily always need different apps and different like things like that to be able to like do everything you need. If the systems can connect, that's one thing. And then the personalization is around like recommending, you know, hey, this week these are the things that you did or did not do, or here's your water intake, or here's your, like just kind of thinking through how can we make your life easier, because we know all the information that can like support you as an individual, your well-being as well. So I think the personalization and connectivity piece is huge.
Yeah, similar to Emmy's point, I like how healthcare and tech, how that combination together saves lives. We know that that's bottom line with the facts, but during the pandemic time, and going back, we're still in pandemic times, right? But I had the opportunity to collaborate with community members, community leaders, NAACP, providers, and have this Black infant and maternal mortality task force. And I mention all this to say is we got in these rooms, virtual rooms a lot of the times as we think about the pandemic, and trying to problem solve. We wanted something that was actionable, something that we could put forth together. Now, what could we do that was touching people, but made an impact? We had to think from a virtual mindset, which was something that was a little bit different for us and innovative. So we created this maternal experience survey. That was us being able to touch tech, That was us being able to ask questions of mothers and birthing people to say, how was your experience? Did you feel like you had suboptimal or negative care? Did you feel like you got dignity and respect when you were at the hospital? And so that was our way to affect the whole state of change in New Jersey. And I just think with incidences like this, where we can work with community and empower community through these different types of experiences and hear their voice is so powerful. So that's what I want to hear, the advocacy and the empowerment.
Yeah, I love that. And we have a lot of healthcare providers in the room. And I know that a lot of times when we see our patients, me also being a healthcare provider, okay, physical therapist now, but that we see patients and a lot of times they don't know their medications. They don't know who they saw last. Sometimes they don't even know what surgery, believe it or not, that they had. And they're coming for rehab treatments. So having these services or apps or just connections is what I'm hearing a lot about between different service providers can really help. And like you guys said, it's important, it can save someone's life. So love to see it. And you guys talked a little bit about this, but I don't know, maybe you guys have some ins from what's going on in your companies, but what do you guys see in the future of healthcare? What are they talking about or is going on in the future of healthcare that we should be looking out for?
Sure. So I can only speak so much on some of that stuff. I don't even like to lie. You tell them all. But I know a lot of us know about AI and ML, but there's also the concept of why we're doing it, right? And we already kind of started this process of being more person-centric, having the individual and their families and their providers all work in tandem to go ahead and drive their healthcare, Nowadays, what we've now started to see is the access to some of the information, right? Before, you had to go to the doctor, make a request, they might mail you your information. Now you can go ahead and have like an end user portal to log into it. But now we're starting to see a trend where it's not just you go to see what happened, right? But also a little bit prescriptive as well. So it's like, you got discharged, here's the doctor's note, but you also want to know the additional services that are associated with it, right? So transportation services, financial services, housing services, and not just having those recommendations there, but acting as a catalyst to go ahead and reach out to those additional services to reach back out to you. That's one of the things that I see the trend in healthcare and enhancing patient-centric. We're already doing it now, but I think that's going to really help drive it. And AI and ML is definitely going to help that out as well.
I too cannot speak on a lot of things. There are real NDAs out there. But I think what you just talked about, so like AI, ML, AR, all of those words are being thrown down our throat every single day. And I do think that there is a lot of value that they're bringing. They've always been around, but now people are thinking about the use cases that make the most sense. And like specifically in the healthcare space, like the predictions, using the algorithms and the models to say like, hey, in the past 3 months, you've had these 3 things. Maybe you should check up on this, or maybe you should think about making this change, or like let's look a couple years down the line if we don't have, these surgeries or these particular care. And I think like having insight into the future, because you don't necessarily always want to wait till something has happened to you. Like if you can think preventatively, and like models are obviously like computers, they can't be perfect, but like if they can give you a certain level of confidence that like, hey, I went to physical therapy and like I'm now feeling these types of things, I'm at least 90% of the way to repair, right? Giving you data about like your body, your health is something that I think the future of healthcare can provide a little bit more around.
Yes.
I'm doing it again. I'm combining some thoughts from our 2 panelists. I can't say a lot either. But what I can say is that at the hospital in which I work, we have a pilot that's happening right now. It's called Digital Health Equity. And with this particular pilot, we all know that with hospital and health systems, we have our MyChart, we have patient portals, right? And with those, we can make our own appointments. We can, check our prescriptions, all the things that our panelists were just mentioning. And I think that the important thing is a lot of us in the room, I'm sure, know how to navigate and to access those things. But once again, when the pandemic hit, it really illuminated the fact that people did not have access to MyChart or know how to maneuver and know how to have those digital, appointments with their provider. So with community health workers, with those that are on the ground, with doulas, we can certainly make a strong impact, I think, in that way, and really have that one-on-one connection to show people how to utilize those systems. And I think the predictability and everything that you just mentioned just feeds right into that. So,
Good. Well, thank you for giving us a little bit, of the tea. Closing out, what advice do you have for all of these wonderful professionals in the room who are interested in these different career avenues that you guys have taken in? What are some things that you guys would advise for them to look out for, to do to advance their careers or to change their careers and pivot?
Sure. So I say my motto is fake it till you make it. But seriously. So for me, I went down 3 paths, right? The first path was, the first thing I did was I got different mentors who were at different stages in their careers, right? I would love to go ahead and talk to the CEO and HC director all the time and cover all these questions, but it's time you visit me, right? So what I did early was I started getting mentors who were at places where I wanted to be at next, and then maybe at a manager level, and maybe at a director level. Every once in a while, I might try to corner that CEO in the elevator, so that was one of the things I did. 2, for a pivot, and I'm speaking again from personal experience as a business analyst. I know a lot of us want to jump in the healthcare field, and sometimes it could be a little intimidating from a technical standpoint, right? You don't have those skills like doing SQL or doing Java or things of that nature. But if you're already in the healthcare, right, whether you're a clinician, whether you're health administration or public health, there's still a technology component to it, And sometimes you need to go ahead and utilize that. That's enough to get you in the door. Because these tech companies, sometimes they say, hey, we have the tool. Technology is essentially the tool. But it's the why that really matters. And you can be that person to come and say, hey, I might not know how to code, but if you have a product, and I can tell you how to make that product better. You have, you're trying to go into consulting states, I know what they want to do. Or these stakeholders, I know what they want to do. Bring me on as a consultant, and as you get that experience, you also get that technology experience as well, and then as a merge together.
That's good. Gems, yes.
Hey.
That was good.
Yeah, no, a lot of the things you said definitely resonated, and so I'll tack on a couple ones that I thought of. I think for sure use your domain knowledge, you already have that information, and anytime you're trying to jump into a new field, don't try to go all the way left. Pick the one thing you already know so that people can be attracted to that. The other piece is start to think about what you do want to do and build a brand around it. So your personal brand, whether it's on LinkedIn, on social media, a blog, we're in the age where if you say you want to do something, show them. What have you done to be I'm interested in working in HealthTech? Are you writing about it? Are you reading about it? Are you commenting on it? Are you even just at the lowest level? Do you follow the people on LinkedIn that are doing what you want to do? So show that you have put in some effort to start, and then tell everybody that's what you're interested in. Like I said, closed mouths don't get fed. You never know when you mention it. We're at HealthTech right now. Anyone you meet that is doing remotely close to what you're doing or working at a company that you're interested in, be hey, I'm interested, set up time, but then do the second piece, which is follow up and then put in the effort to say hey, I am actually interested. Because a lot of times people come up to me and they're oh hey, I want to work in this. And I'm cool, set up time, send me an email. No email has been sent. So if you are actually one, make sure it is the goal for that year. Is this the goal that I'm serious about? And then make sure you spend time putting effort into that brand that you want to create.
yeah, for sure. I think that research component is such a paramount piece. Because getting into the public health field, it was more or less trying to, once again, like I mentioned, trying to figure out what public health was. But then there's so many different topics of interest and different pieces of which you can land, right? So just thinking about that research component for me was also any type of certifications I could take or any type of webinars that I could attend. And just like MP mentioned, with those different type of connections or folks that you might see, set up and be intentional about those different one-on-ones and connections that you could make. Also that your network is your net worth. So taking time to find your community. Up in Philadelphia, really just creating the public health joint as a sense of where we can build community capacity together, having events and talking to each other and building connections. But then also just thinking about what other type of coalitions are around you, what type of other community action networks or whatever it is that you're interested in and getting involved. And I think lastly, finding a mentor. So someone that could really just be there and guide you through the process, but then also realizing that that mentorship is symbiotic. So they're pouring into you with their great wisdom and knowledge, but then you can provide a new article or a new technique to that sponsor or that mentor as well. So those would be my thoughts, yeah.
Good gems, guys. We love it. So now we'll open it up to the audience. The panelists said they would be willing to take some questions. And you know, they dropped some gems here, but if you ask the right question, you might get some little bit of extra. So anyone have any questions? We're gonna take a couple of questions, not too many. Don't be shy.
Don't come all at once now.
Oh, okay. Oh, yes.
Loud and clear.
Hi, I'm Jasmine. What do you guys think is the biggest impact that you have made working in your respective fields?
Everyone was quiet. So they were They are such movers and shakers, they don't even know where to start. Okay? All right.
I'm trying to remain humble. but it's good to know, right? So humility is something, right? So when I was working for the government, I was, again, managing like long-term care services, but I was also like the young kid, right? Everyone was older than me, so if there was ever some task that I was too hard, they just throw my way. So one time, they put me in court, right, to defend an assessment for the state that they had just designed. And I failed horribly, right? I'm in front of the judge, no prep. The judge is lining me up. I'm not an attorney, nothing, right? And so what ended up happening was that the next attorney in the line saw that, and their case was up next. And so they said, hey, she said to me, you're not going to embarrass me. But more importantly, you're not going to embarrass yourself. And so she put me through 3 weeks of the fast track law school. And we got up there in the court and we won and defended the assessment. I was able to win and defend the assessment. And the reason I'm saying this is because that assessment ended up being that assessment ended up establishing the standard for the other assessment that came about, which ended up saving the district over like $23 billion, you know, because it now said, okay, these individuals don't necessarily need these services. We're able to go ahead and justify that based upon the assessment that the nurses did. And then some of you are clinicians, you know, about like activities of daily living and as such. So to me, that's the biggest impact, you know. I failed at first. I had somebody in my corner supporting me, and as long as they support me, I was going to continue fighting. That's what I did.
Excellent.
Okay, biggest impact. I'm gonna pull from, so there's one use case in personalization that for a particular cruise line, so this is a little bit morbid, but so sometimes people fall off the ship. And to be able to like track where people are or like, you know, make sure like if someone does have a health crisis or something like that, a wearable device is one thing that we wanted to create and bring together different aspects of like, what are your healthcare data? What are your different, you know, like also how many drinks have you had? That is irrelevant, but all of that was like in one device that we wanted to create. And it was really, really hard to do. And I was like the functional lead on this particular project, working with like engineers, like we were on the ship trying to get it together.
Talk your shit, black woman. You did that.
And one of the things that I was just like, hey, y'all, like let's think about like the smallest thing that we can build and tack onto that, because we were trying to think too much at once. And sometimes when people have big, grand ideas, like leadership comes with big ideas, they don't know how to make it small. And like for me, I'm a very process-oriented person, so I was like, let's get down to the very granular piece that we can do. Ended up like driving that project to completion, like had one of the like largest implementations without having like a complex implementation with the least amount of like bugs and defects that you would expect for such a large thing. And then they ended up like putting that in all the marketing specs, all the marketing docs, and you know, making millions of dollars off of that. So, you know, somebody made money.
Oh man, I would say going back to earlier when I mentioned that maternal experience serving, I think that was a really pivotal part of my career because we're creating something from the ground up. Folks that, like myself, didn't necessarily have the tech background and the experience, but then also at the same time working aside and alongside of communities to make sure that that voice was present, doing those focus groups, beta testing, like all of that very intentional processing. And we started with a launch in one of the counties that had the highest rates of preterm birth, and then launched it out progressively to other counties within the state of New Jersey that also had the highest rates of preterm birth, maternal mortality, and infant mortality. Another piece that I think of that coincides with that project is we had something called Go Kits. Within these Go Kits, they had a blood pressure cuff, a thermometer, all these different type of technical pieces that a mom or birthing person would need as we once again think about the beginning of the pandemic. There's that provider gap in communication, right? So that was something that was very significant too because it went to all the hospitals in New Jersey and had that impact to lower preeclampsia, to lower mortality and morbidity, just because moms were able to check their blood pressure and have those warning signs available to them and to know if something was wrong and to indicate that. So those are some of the pivotal moments for me.
Well, thank y'all so much for being part of our panel this evening at Healthcare Meets HealthTech networking event by the Socialite PT. So that's me. So thank y'all so much. And guys, if you have some questions, if you're like, hey, I'm gonna pick their brains, I'm interested. You have some like leaders in their respective fields, and you know they're being a little shy. They're not telling us everything that they do, but they do so much for their communities, and they represent our community so well. So thank you guys so much for what you're doing. Oh, of course.
While you were talking, I do realize another way if you want to like connect with the community that you're with is throw an event like Lola did. So like find your people by throwing an event and getting the community members together. So I just want to say congratulations, girls.